Hello, my name is Mary Waturi Keriaku. I am born again. I love the Lord Jesus Christ. And I am wife to Reverend Dr. Johnson Keriaku Akenyua, the founder of KWR, a radio where we tell our stories together. And it's an absolute honor to be able to share my story and to have this time to speak about a subject that is close to my heart and to share something that I hope is a blessing to many of us in the diaspora. Now, I will begin by telling a story. It is a true story of something that happened to my family a couple of years ago, maybe 4 years. And with the permission of my son, I want to share something that happened to him. So one Sunday, we were going to church, and while we were in the car, he asked us whether it would be okay for him to tell the church members what was happening to him. And what it was, he was dealing with severe anxiety. He was in high school, 1 year to graduation, and throughout high school and with a move from one state to another and starting school in a new state, in a new school, he was dealing with significant anxiety, and it was expressing itself physically with the tic syndrome. I don't know how many of you know the tic syndrome. It's a condition where the body has involuntary movements. So for him, it was his head and his speech, and you could see it. And I know many of the church members do remember that period. And so he asked if he could talk about it, because his therapist had encouraged him that sometimes people respond, or sometimes people don't know how to respond because they just don't know what is going on. So he took the chance, and it took courage for him to want to talk about it. And so when we thought about it, we did not discourage him. We said, if that feels supportive, you can talk about it. So here we go into the church, and he's given the forum to talk about it. And when he stood to speak, the tic syndrome became quite severe right at that moment when he is speaking. And many people in the church, of course, were confused and caught off guard. And I think many had never seen or witnessed anything like that. So moved with love, moved with confusion, moved with not understanding what is going on, many came forward trying to comfort him, trying to suggest to him what he needs to do. Others prayed for him, and others actually were casting demons, thinking that something is going on with him, and that needed all those kinds of responses. So the whole episode was quite something for all of us, for anyone that was there and those that remember, because it's not so long ago, and many of the people that I fellowship with do remember this time. And so I'm always thankful to one and only Dr. Nancy Jerry Waba, who came forward and recognized what was going on and actually pulled our son aside and talked with him and calmed him down and explained to him, how much maybe people just don't understand, and really just took the situation away from being center stage, while my husband and I were left trying to bring back order to the situation. And then I went back to my son, and I was asking him what he would want to do, and he said, that's okay, and we'll try to explain that another time. So what I want to talk about is really, like I say, close to my heart, something that is mental health in children, and how many of us in the diaspora are dealing with our children, the children of our friends, children of our relatives, dealing with situations that are sometimes easy to understand, situations that we have mastered how to deal with, or situations that we have not mastered, are not feeling confident on how we walk the journey or how we respond to what is going on with our beloved, or even ourselves, and we don't know how to deal with it or how to respond. So on this opening session, I want to bring to our attention that it is important to educate ourselves on how we respond to a situation if we do not understand, or if we understand but not fully, or if what does it call for? Is that what we are offering? That's what I would like to speak with. In this conversation, I'm gonna the word of God encourages me in moments like many situations like this. I am reminded of Paul in 2 Corinthians chapter 12 and verse 19. Paul was dealing with something that he felt like it's a thorn in his flesh, which meant he felt it every day. He felt it even as he tried to do his daily things. He was feeling this pressure, the pain, and it was just not going away. It was just not changing. It was affecting how he was operating. And when he sought an explanation or a reassurance or even an end to the situation, the response from God was, "My grace is sufficient for you, for my power is made perfect in weakness." So I want to encourage us and to encourage myself as well, that sometimes it is in those situations when there is that kind of weakness, there is that kind of a chronic disease that you have to deal with. And many of these mental health conditions in the children and even in the adults are chronic. They are not things that end in a day. They are not things that end so quickly and so easily. They may need long-term management. They may just go under control but not completely healed. But what the Word of God tells us is that God's grace is sufficient. That grace is available for you. And God's power is made perfect in weakness. Sometimes it's in that weakness that God's ability, God's power, God's intention, God's overwhelming capability to heal or to restore, overwhelming capability to change a situation from being a weakness to being the very thing He will use to encourage, to educate, to empower, to strengthen others. That is what God is able to do. That in that weakness, God can be glorified. In that situation, God can show and demonstrate His capability, His power. In that situation, He can demonstrate His capability and His power to heal, to restore, to do abundantly more than we can imagine, more than we have thought about, more than anyone has wished us, more than anyone has imagined about our children. So if it is you, my friend, who cross my mind at this time, you, my relatives who are dealing with children, dealing with mental health, dealing with anxiety, dealing with depression, dealing with ADHD, difficult to understand, difficult to control, difficult to tell where does normal behavior end and it becomes a mental health disorder, when it is a gray area where, we know that most of the children, or most of us actually, not just the children, there is a level of anxiety, there is a level of discomfort, of fear, of sadness that is inherent in being in this world that all of us deal with on a daily basis. When these things stop to be normal, and it's no longer normal fear, it's no longer normal sadness, it's no longer normal hyperactivity, it is no longer normal sleepiness, but it is now a disorder. When those gray areas happen, how are we responding? How are you feeling in that moment of weakness? It can be the very moment when God's power is perfect. So we're going to stay hopeful. We're going to stay encouraged. We're going to stay enthusiastic to understand. That way we are more equipped. That way we are more responsive in a way that is helpful, in a way that moves an individual, be it a friend, be it a child, be it a family member of any kind, a cousin, a nephew, a niece, that you are the one that is dealing, that is witnessing something. that needs to be responded a certain way. What are the right words to say? What is the right body language to have? What is the understanding that you need? Or what is the mindset that is needed as we approach these situations? And I think that will go a long way as we make it possible for each other to bear successfully, supporting our children, supporting our beloved. That if I'm to support another sister that is dealing with a situation, does my knowing my situation help? Does your knowing your situation or educating yourself on the situation help in how you respond to another person or to a situation that you encounter? And just as a summary, when we talk of mental health, I don't know, many of us may be wondering even, what is she talking about? What is mental health? Mental health, when our brains, our emotions, and our bodies are operating in their optimum, in how they are, like you are able to function for the children, maybe at home, at school, at play, in a way that they are able to optimize their capability without being hampered by how they are feeling, then they are mentally healthy. When how they are feeling, how they are processing the environment, the stimuli around them, starts to get in the way of their productivity, starts to get in the way of their completing tasks, starts to get in the way of how they are relating with the environment around them, including things like the people around them. How are they reacting to the people around them, to the task ahead, ability to complete homework, ability to sleep through the night, restful sleep, to stay in one place and to stay focused on a task until it's complete, ability to complete a meal and enjoy it. When how they are feeling starts to affect their capability to optimize how they work, then it's time to watch that. Are we treading now beyond normal situation, normal anxiety that comes with maybe something like a test? Some level of anxiety is expected by anyone, and in any situation which requires a change in mindset, a change of activity, a change in the school setting, a new teacher, a new subject, getting close to the end of a semester. All those things are things that could trigger some level of anxiety. But when the anxiety prevents you or prevents a child from being able to deliver what they are supposed to deliver, to complete a task, to complete what is beyond them, to complete a goal, or to how to starts to get in the way of how they are relating with the parents, with their teachers, with their colleagues, with their peers at school, because they are too afraid to talk. They are too afraid to even handle. They are too agitated, too restless to sit in one place and complete the task. All those could be signs of it not being regular anxiety, but more of an anxiety disorder. The most common ones, of course, like I mentioned before, would be things like the ADHD for younger children and even older children. Then there is the anxiety, and then depression. And when we talk of depression, it's things like sadness for something that has happened or for what a child is experiencing. It's when there is loss, when there is the experience of something not going well, a level of sadness is a normal response to life situations. But when this sadness is persistent, it goes on and on despite even this resolution of whatever it is that was causing the sadness in the first place. It's resolved, but the sadness is persistent. And also then it starts affecting maybe the sleep patterns. It starts affecting the coping and completing of tasks, being the sensation of being overwhelmed, that does not know where to start or how to end, and the sensation of hopelessness, of not having hope that anything will get better or it will get better, then those may be signs of depression. And how we respond before, like in the home situation, of course, a proper diagnosis, a proper evaluation by a professional is super important, and of course the priority. And that may be what the parents may be dealing with. That's what the caregivers may be dealing with, trying to establish a proper diagnosis, a proper treatment plan, and the proper treatment for that. But my focus is on how we respond when maybe a child is already under treatment, but they are still exhibiting symptoms. A child may still be seeing a therapist, may still be engaged in a treatment, in a recovery journey even, but they may be exhibiting symptoms. How are we responding? How are we educating ourselves on mental health? That way we can respond in ways that are more supportive, in ways that are more understanding, in ways that are not judgmental, in ways that are not driven by fear, in ways that are not driven by over-spiritualizing and always blaming the devil on these things, while we know that the devil comes to steal, kill, and destroy. While we know that he is the father of all lies, we also know that we are more than conquerors through Christ who loved us. And we know that the intention of God is that we may live life and live it in abundance. So we know that when the brain is sick, then God's will is to heal us. When we know that when our children are sick emotionally, God's will is to heal them. And so the antagonism is to pray for recovery, is to believe that, yes, we know the devil intends to damage, but we shall not dwell on just that, but on educating ourselves that just like when a broken leg needs, being splintered, being casted, being given time to rest for it to heal. When we have a diagnosis of blood pressure, what is needed is reduce the weight, watch the salt, do these things that are practical, that will bring resolution, take the medications. It's the same kinds of responses. Yes, we shall pray for the healing, for it is God's promise to heal. We shall pray that the power of Satan is not overwhelming us, that it is cast, the demons are cast, but also we shall believe that the brain can heal through treatment, through support, through a network of understanding, through a network of self-education and exposing ourselves to knowledge of health conditions, of mental health conditions. When does it stop being normal behavior to being a mental disorder? And how do we respond in a way that is supportive, non-judgmental, in a way that leads to seeking more help, leads to seeking more support, leads to seeking hopeful behavior that can bring healing, restoration of health, restoration of hope, restoration of the capability to keep up with a treatment plan. Because if a diagnosis has been made, and if an individual is under a professional's treatment, that means they probably are on therapy, they probably are on a regimen of medications, on a regimen of exercises they are doing on their journey to recovery. When we don't know all of that and we see a behavior, would it be helpful, first of all, to sit back and ask ourselves, are we approaching from a place of fear? That way we catch ourselves so that our body language does not worsen. A child who is already anxious and afraid, and we approach them with fear, we approach them being scared, we approach them with our own anxiety, which only worsens their anxiety. Where would it be more helpful to recognize our own bias, our own not understanding that maybe I don't know what is going on, and therefore I will sit back and kind of let whoever know what is going on deal with the situation. Let them talk about it. And how about responding by asking more questions? Would it be more helpful to ask the parent, do you know what is going on? Has your daughter seen a doctor? Are you under treatment? Have you worried about this behavior? Have you seen it before? What have you done so far? Because that will give us a better way to respond, a better understanding of where to come from. And that way, if the parents are already dealing with it in a certain way, then we can ask, how can I be of support? That way you support them in the journey they are already on. Maybe adding just comfort, maybe adding just a shoulder to lean on, maybe just adding an opportunity to talk and to vent, maybe adding the opportunity to suggest another doctor that you might know, to suggest something else that may be more helpful than being judgmental that they probably have not done enough. Probably it was their grandparents that cast them. Maybe there is something they did not do. Maybe they are demons to be casted. All those things that are sometimes driven by our own not understanding, our own not knowing where people are coming from. I like one of my friends on social media who likes to say, people are going through things that you have no idea about. So give it space. I may have paraphrased, but everybody is fighting a battle that you may not have an idea what they are dealing with. So sit back and first explore what is going on before you make a word, before you make it worse, before you respond with a response that is more destructive than helpful. And I think when we all sit back, when we all seek to know, when we all know more about these conditions, we know how they express, when we take time to understand, when we take time to educate ourselves or to look up, and a lot of information is actually pretty available, and maybe more forums where we are talking about what is going on, more forums here on this radio that will be coming where we shall be discussing specific conditions, specific ways that are, and especially and specifically for our children in the diaspora, because sometimes we are not always very comfortable about talking what it is that, because maybe at home we were told it's something else. Maybe at home there are stereotypes that can get in the way of us talking openly about some of these conditions. So when culture plays into it, when our own inhibitions play into it, some of these conversations can be difficult talking about them in other forums. But when we talk about them in our own safe spaces, within our own circles, where there is understanding, where there is that knowing of where we are coming from, places where we have grown, experiences of our own parents, experiences of what home is, and where the traumas that some of us have gone through. When we think about when we came into this country, some of our children, when they grow into or when they are transitioning into the country, we worked so hard to give them a better living. So maybe they got traumatized by the lack. They got traumatized by how many hours we worked. They got traumatized by how many hours they had to be watched by people they didn't know, in daycares where they didn't have the language, in daycare where they did not understand the culture. Has that trauma gone on with them? And now in adulthood, in young adulthood, it's expressing. When we talk in our own safe spaces, when we are able to understand one another, when we are able to express our own fears, our own experiences, from a place of understanding, from a place of knowledge, from a place of having lived cultures in our home and cultures in the diaspora. When we have transitioned and hopefully successfully transitioned, how do we successfully support one another or new immigrants, new parents, parents who are bringing kids when they are adult already, or in high school, or in college, and they are transitioning into the new culture, into the new country, with new challenges, with new dynamics, having to learn new things. And all these things have potential to either trigger new mental health issues or worsen existing mental health issues. But I want to encourage us and to welcome us into a place of making ourselves some safe places where we can talk about it, where we can support one another, where we can educate one another on how we can tell early something is going on. We can tell early something needs to be addressed. Or how did you approach it? So was it helpful? Is it something that I can apply in my situation? Is it something that you have seen in your child? Or is it something that may be even more detrimental? And all that kind of thing. And I think when we have these kinds of conversations, then we become a shoulder one to another. When we have these conversations, then I think we will be better able, and in more times than not, respond in more helpful ways, in more supportive ways, in more resourceful ways, in ways that protect each other's integrity, in ways that protect each other's confidentiality. Because how many of us have heard stories of our children dealing with addictions, our children dealing with alcoholism, with issues of drugs, issues of just not having a clear way of how to get their way around being an adult. And they are overwhelmed. And you tell your story to a sister, to a brother, thinking it's confidential information, and then you hear it repeated somewhere else, and you're like, how did we get from being each other's keepers, a brother's keeper, to being each other's destroyers, each other's that we cannot protect each other? I would hope and I would pray that when we create spaces where we are self-educated, where we are thinking support, where we are thinking helpful ways of responding, then we will have less of that, or of those situations that cause us so much fear to talk about what is going on in my life, because I don't want it to be news in the next forum where the ladies are talking. I don't want to be the hot thing that people are discussing in the community. I don't want my child to be the top thing that people are discussing. We are so afraid to share, because then it becomes so uncomfortable when we hear it, that information was not handled with care, it was not handled with tenderness, it was not handled with understanding, it was handled with pointing fingers, judgment, misunderstanding, and all that type of thing that is oftentimes not caring and not supportive. I wish to end this introductory conversation here with a hope to bring a lot more on mental health, on specific subjects, on specific issues. And I would welcome any kind of response of what you would want us to talk about, what you would want to hear more about. Because like I mentioned, I am a pediatric nurse too, and I'm actually studying more on behavioral health and mental health issues. So, and I know this is a topic we cannot exhaust. We are listening things about mental health from all angles, but I don't think it can be a waste. When we talk, the more we talk about it in different forums, in different languages, from different approaches, I believe it is the way to get educated, to get to know more, to become more resourceful, to open up forums for more support. Some people like to talk in the secrecy of their homes. Other people like to talk in social media. Other people like to talk in their church forums within their family, and they don't want it outside of the family. So as diverse as we are, just as important as it is to talk in different forums. So I look forward to hearing what your thoughts are, what the interest may be, where you would want to hear more about this, and what exactly you would like to hear more about. And I look forward to talking more. I look forward to hearing your responses. I look forward to bringing more on this subject. And we can delve deeper as much as the opportunities allow. So I do want to thank you for taking the time and to thank God for the chance to speak on the subject this afternoon. Okay, thank you and bye-bye.